Hey there! Today I'll be talking about the different types of transgender that we as future speech language pathologists may come across, as well as the voice therapy and surgical procedures that they may go through. So what is a transgender? A transgender refers to a population of individuals whose gender identity differs from their assigned sex at birth. So now we have two categories of transgender. We have a transfeminine and a transmasculine. Now, when we're talking about the differences, what makes a transmasculine different from a transfeminine? Well, a transmasculine are individuals born as female at birth and they transition into male, and typically the hormonal therapy works for them. However, in transfeminine, those are individuals born as male and they transition into female, and typically the hormonal does not work for them. Fact number one, most voice interventions for individuals who are transgender occur via hormonal therapy, specifically those who are considered transmasculine. However, both transmasculine and transfeminine both partake in voice training by speech language pathologists. Now, when we're talking about voice therapy, individuals who are considered transfeminine or MTF are typically seeking voice feminization voice therapy from an SLP. These transfeminine make the majority of our caseload. So during the voice feminization therapy, the SLP mainly targets the pitch, the prosody, and vocal resonance. Other aspects of the voice, such as the voice quality, articulation, and speech rate phrasing, are targeted but are not the main focus in therapy. Now, when we're targeting pitch in therapy, we're trying to increase the transfeminine's fundamental frequency speaking voice. Their voice should be trained to stay above 165 hertz or more. Now, when we're looking at prosody in therapy, men tend to use stress or loudness for emphasis, while women often use greater pitch variability. So in therapy, we're trying to have the transfeminine use greater pitch variability. The last main focus is vocal resonance. The speech language pathologist helps the transgender population find a healthy resonance that reflects who they are. This, however, takes determination, practice, exploration, and experimentation with their voice. Now, diving into the surgical aspect of voice feminization, there are two surgeries that a transfeminine may undergo to achieve their gender identity: anterior glottal web formation and a cricoid thyroid approximation, also known as CTA. The anterior glottic web formation surgery creates a web or scar band at the front of the anterior commissure. This surgery shortens the vocal cords to help raise voice pitch. It affects frequency range by eliminating the ability to produce lowered pitches. The cricoid thyroid approximation surgery, also known as CTA, fixes the cricoid cartilage to the thyroid cartilage, elongating the vocal cords. This results in a higher speaking pitch and a reduction in the ability to lower pitches. The thyroplasty surgery. It's a surgery typically conducted for those individuals who are seeking to lower their pitch, specifically the female to male population, hence why it's called the pitch lowering surgery. By doing so, their thyroid cartilage is open to have their vocal folds in a more relaxed position with less tension. In conclusion, as a transgender, it is important to find the voice that matches your gender identity. Voice feminizing therapy and surgeries are just tools to help your voice sound more feminine. And lastly, your result will depend on the techniques used as well as the effort you put in practicing. Well, with that being said, I hope you learned more about transgenders and how we as future SLPs can treat them while in therapy. Thank you for watching. Bye.